Question 51. The client with suspected meningitis is admitted to the unit. The doctor is performing an assessment to determine meningeal irritation and spinal nerve root inflammation. A positive Kernig sign is charted if the nurse notes a. Pain on flexion of the hip and knee. B. Nuchal rigidity on flexion of the neck. C. Pain when the head is turned to the left side. D. Dizziness when changing positions. Answer A is correct. Kernig sign is positive if pain occurs on flexion of the hip and knee. The Brudzinski reflex is positive if pain occurs on flexion of the head and neck onto the chest, so answer B is incorrect. Answer C and D might be present but are not related to Kernig sign. Question 52. The client with Alzheimer's disease is being assisted with ADL when the nurse notes that the client uses her toothbrush to brush her hair. The nurse is aware that the client is exhibiting A. Agnosia. B. Apraxia. C. Anomia. D. Aphasia. Answer B is correct. Apraxia is the inability to use objects appropriately. Agnosia is loss of sensory comprehension, anomia is the inability to find words, and aphasia is the inability to speak or understand, so answers A, C, and D are incorrect. Question 53. The client with dementia is experiencing confusion late in the afternoon and before bedtime. The nurse is aware that the client is experiencing what is known as A. Chronic fatigue syndrome. B. Normal aging. C. Sundowning. D. Delusions. Answer C is correct. Increased confusion at night is known as sundowning syndrome. This increased confusion occurs when the sun begins to set and continues during the night. Answer A is incorrect because fatigue is not necessarily present. Increased confusion at night is not part of normal aging, therefore, answer B is incorrect. A delusion is a firm, fixed belief, therefore, answer D is incorrect. Question 54. The client with confusion says to the nurse, I haven't had anything to eat all day long. When are they going to bring breakfast? The nurse saw the client in the day room eating breakfast with other clients 30 minutes before this conversation. Which response would be best for the nurse to make? A. You know you had breakfast 30 minutes ago. B. I am so sorry that they didn't get you breakfast. I'll report it to the charge nurse. C. I'll get you some juice and toast. Would you like something else? D. You will have to wait a while, lunch will be here in a little while. Answer C is correct. The client who is confused might forget that he ate earlier. Don't argue with the client. Simply get him something to eat that will satisfy him until lunch. Answers A and D are incorrect because the nurse is dismissing the client. Answer B is validating the delusion. Question 55. The doctor has prescribed Exelon, rivastigmine, for the client with Alzheimer's disease. Which side effect is most often associated with this drug? A. Urinary incontinence. B. Headaches. C. Confusion. D. Nausea. Answer D is correct. Nausea and gastrointestinal upset are very common in clients taking acetylcholinesterase inhibitors such as Exelon. Other side effects include liver toxicity, dizziness, unsteadiness, and clumsiness. The client might already be experiencing urinary incontinence or headaches, but they are not necessarily associated, and the client with Alzheimer's disease is already confused. Therefore, answers A, B, and C are incorrect. Question 56. A client is admitted to the labor and delivery unit in active labor. During examination, the nurse notes a papular lesion on the perineum. Which initial action is most appropriate? A. Document the finding. B. Report the finding to the doctor. C. Prepare the client for a C-section. D. Continue primary care as prescribed. Answer B is correct. Any lesion should be reported to the doctor. This can indicate a herpes lesion. Clients with open lesions related to herpes are delivered by cesarean section because there is a possibility of transmission of the infection to the fetus with direct contact to lesions. It is not enough to document the finding, so answer A is incorrect. The physician must make the decision to perform a C-section, making answer C incorrect. It is not enough to continue primary care, so answer D is incorrect. Question 57. A client with a diagnosis of HPV is at risk for which of the following? A. Hodgkin's lymphoma. B. Cervical cancer. C. Multiple myeloma. D. Ovarian cancer. Answer B is correct. The client with HPV is at higher risk for cervical and vaginal cancer related to this STI. She is not at higher risk for the other cancers mentioned in answers A, C, and D, so those are incorrect. Question 58. During the initial interview, the client reports that she has a lesion on the perineum. Further investigation reveals a small blister on the vulva that is painful to touch. The nurse is aware that the most likely source of the lesion is A. Syphilis. B. Herpes. C. Gonorrhea. D. Condylomata. Answer B is correct. A lesion that is painful is most likely a herpetic lesion. A chancre lesion associated with syphilis is not painful, so answer A is incorrect. Condylomata lesions are painless warts, so answer D is incorrect. In answer C, gonorrhea does not present as a lesion, but is exhibited by a yellow discharge. Question 59. A client visiting a family planning clinic is suspected of having an STI. The best diagnostic test for treponema pallidum is A. Venereal Disease Research Lab, VDRL. B. Rapid Plasma Reagent, RPR. C. Fluorescent treponemal antibody, FTA. D. Thayer-Martin culture, TMC. Answer C is correct. Fluorescent treponemal antibody, FTA, is the test for treponema pallidum. VDRL and RPR are screening tests done for syphilis, so answers A and B are incorrect. The Thayer-Martin culture is done for gonorrhea, so answer D is incorrect. Question 60. A 15-year-old primigravida is admitted with a tentative diagnosis of HELLP syndrome. Which laboratory finding is associated with HELLP syndrome? A. Elevated blood glucose. B. Elevated platelet count. C. Elevated creatinine clearance. D. Elevated hepatic enzymes. Answer D is correct. The criteria for HELLP is hemolysis, elevated liver enzymes, and low platelet count. In answer A, an elevated blood glucose level is not associated with HELLP. Platelets are decreased, not elevated, in HELLP syndrome, as stated in answer B. The creatinine levels are elevated in renal disease and are not associated with HELLP syndrome, so answer C is incorrect. Question 61. The nurse is assessing the deep tendon reflexes of a client with preeclampsia. Which method is used to elicit the biceps reflex? A. The nurse places her thumb on the muscle inset in the antecubital space and taps the thumb briskly with the reflex hammer. B. The nurse loosely suspends the client's arm in an open hand while tapping the back of the client's elbow. C. The nurse instructs the client to dangle her legs as the nurse strikes the area below the patella with the blunt side of the reflex hammer. D. The nurse instructs the client to place her arms loosely at her side as the nurse strikes the muscle insert just above the wrist. Answer A is correct. Answer B elicits the triceps reflex, so it is incorrect. Answer C elicits the patella reflex, making it incorrect. Answer D elicits the radial nerve, so it is incorrect. Question 62. A primigravida with diabetes is admitted to the labor and delivery unit at 34 weeks gestation. Which doctor's order should the nurse question? A. Magnesium sulfate 4 gm, 25%. 4. B. Brethine 10 micrograms 4. C. Statal 1 mg 4, push every 4 hours as needed PRN for pain. D. Ansif 2 gm IVPB every 6 hours. Answer B is correct. Brethine is used cautiously because it raises the blood glucose levels. Answers A, C, and D are all medications that are commonly used in the diabetic client, so they are incorrect. Question 63. A diabetic multigravida is scheduled for an amniocentesis at 32 weeks gestation to determine the L/S ratio and phosphatidylglycerol level. The L/S ratio is 1:1 and the presence of phosphatidylglycerol is noted. The nurse's assessment of this data is: A. The infant is at low risk for congenital anomalies. B. The infant is at high risk for intrauterine growth retardation. C. The infant is at high risk for respiratory distress syndrome. D. The infant is at high risk for birth trauma. Answer C is correct. When the L/S ratio reaches 2:1, the lungs are considered to be mature. The infant will most likely be small for gestational age and will not be at risk for birth trauma, so answer D is incorrect. The L/S ratio does not indicate congenital anomalies, as stated in answer A, and the infant is not at risk for intrauterine growth retardation, making answer B incorrect. Question 64. Which observation in the newborn of a diabetic mother would require immediate nursing intervention? A. Crying. B. Wakefulness. C. Jitteriness. D. Yawning. Answer C is correct. Jitteriness is a sign of seizure in the neonate. Crying, wakefulness, and yawning are expected in the newborn, so answers A, B, and D are incorrect. Question 65. The nurse caring for a client receiving intravenous magnesium sulfate must closely observe for side effects associated with drug therapy. An expected side effect of magnesium sulfate is: A. Decreased urinary output. B. Hypersomnolence. C. Absence of knee-jerk reflex. D. Decreased respiratory rate. Answer B is correct. The client is expected to become sleepy, have hot flashes, and be lethargic. A decreasing urinary output, absence of the knee-jerk reflex, and decreased respirations indicate toxicity, so answers A, C, and D are incorrect.